Hi, this is my NG med and NG removal video. So I'm out at the med cart and I'm going to hand hygiene. We are going to get a medication ready for Mrs. Jones. She is having moderate pain, so we're going to check her drawer with the MAR and confirm that we have Jane Jones. We're going to confirm her medical record number and date of birth, and that all matches, so we have the right drawer. So for moderate pain, we are giving Tylenol 325 milligrams. So we pull out the Tylenol, and then we are going to pour it into the cup. Okay, so we're going to check that we do in fact have Tylenol, 325 milligrams, and the bottle states 325 milligrams per 15 ml, so we're going to give 15 mLs. It is scheduled as a PRN. It goes through the NG tube. It has not been given. We have the right patient, Jane Jones. No known allergies. So then we're going to pour it into the cup at eye level. And we're going to give 15 ml. Go and put that away. Get our other supplies for giving a med through an NG tube, and then we're going to bring all of this into the patient's room, the med, the MAR, and this. So we go to the patient's room, knock knock, hello, it's Samantha, your student nurse. I'm going to close the curtain for privacy, do my hand hygiene, and then my two patient identifiers. Can you please spell your last name for me and state your date of birth? Okay, and it is Jane Jones. That all matches. So then, Mrs. Jones, I'm going to take a listen to your abdomen, okay? So we're going to perform our abdominal assessment. First, we're going to inspect her abdomen, make sure it's not distended or rotund, inspect the umbilicus, that it's symmetrical, flat, good color. Then we are going to listen. We're going to listen to all four quadrants for 15 seconds to a minute, or until we hear bowel noises. And she has good bowel sounds in all quadrants. So next we're going to palpate the abdomen, see if there's any tenderness, masses, and that all seems good. So we're going to cover her back up. And then before we give her med, we want to raise the bed up 30 to 45 degrees ahead of her bed. So then I'm going to check the placement of her tube before we administer anything through it. So first we want to check the marking by the nose, and the marking looks good. It hasn't moved at all according to what's in the documentation. So next we are going to draw up 30 milligrams of air. 30 mLs of air. Okay, and Miss Jones, I'm just going to uncover you again so I can listen to your stomach. So we're going to uncap this. insert this here while at the same time listening to the stomach. I know I'm getting all these tangled. So I'm going to place the end of my stethoscope on her left side, right on the stomach, and listen while I push the air in at the same time. And we heard the air come through, so that's a good sign. Then next we are going to use the syringe to aspirate the stomach contents. We're going to visually inspect it, see the amount, consistency, color. That all seems to be good, so I'm going to replace it, put it back in. If it was more contents than our 60 milligram syringe here, we would put it into a basin, measure it, and then also we could use pH paper at that point to look at the pH. So we're going to put that back in. Then we are going to do our final check of our medication. We do indeed have Jane Jones. We are giving Tylenol 325 milligram, which is 325 milligram per 15 ml. We have 15 ml. She has no known allergies. So then we are going to draw 30 ml of water into our syringe and flush her tube before we give the medication. Flush that in there. Gonna keep the tube up. And then get our medication in our syringe. Try to get out any air that we can. While still having all the medication. And then we're going to put that in. After we put our med in, we're going to flush with another 30 mLs of water. If we did have multiple medication, we would flush with 5 mLs of water in between each medication as well. So we put in the 30 ml, and then anything we use to flush the line, in this scenario, a total of 60 mLs is going to go on her intake and outtake intake and output documentation. So after the med has been given, we're going to get her comfortable. We're going to leave the head of her bed up for 60 minutes. Leave the tube up so there's less chance of aspiration, or try to leave the tube up. And lower the bed, but still leave the head of the bed up. I'm going to document the med that I gave on her MAR, do my hand hygiene, and then separately over here we're going to use this mannequin for tube removal. So I'll come in the patient's room. I'm going to identify myself. Hi, I'm Samantha, be your student nurse. Do my hand hygiene once I entered the room. Put on clean gloves. Explain the procedure. Miss Jones, I'm going to be removing your NG tube. And when I do so, I would like you to take a deep breath and then hold your breath while I'm pulling it out. So I'm going to unclip this from her shirt. I would take the tape off of her nose. And all right, Miss Jones, big breath in and hold it and pull it out. I'm going to take this, throw it away. Put my side rail back up, make sure she is comfortable. Perform my hand hygiene. That's it.